once you have a diagnosis of cancer, one of the questions that comes up first is we need full stage of the disease. Is the lung cancer restricted to the lungs or has it spread beyond? So some of the tests that the doctor might do is a CT scan, which basically looks at everything neck and below to make sure that there is no cancer in other parts of the body. And a PET scan is often done as well. A PET scan often tells us that the spots that we see on the CT scan are these fast growing tumors. So it helps confirm what we see on a CT scan. An MRI of the brain is done to complete the staging, because a lot of patients with lung cancer can also have the disease migrate to their brain. And it's helpful when you go see a doctor to ask if there's a coordinator or a navigator available for new patients, because having somebody as a point person in the clinic is very helpful when you're trying to get all of these tests scheduled. It's best if you can try and get them done the same day to make sure it works around all the other schedules and life things that are happening. So having a high quality center or a high volume center that has coordinators or navigators available for care can really help make this process efficient to give you the stage of the disease as soon as possible. Effectiveness of care. And this is something that is coming up a lot in discussions if you are somebody that listens to the scientific meetings like ASCO. Lung cancer is not one disease anymore. A lot of the cancer care that we provide is now very personalized, which means that no two people with lung cancer have cancer that behaves exactly the same way. You can have lung cancer that have different kinds of genomic alteration. The tumor has different kinds of genomic alteration, which means that information can potentially be used to direct specific therapies to you, which might be different from somebody else with lung cancer. So it's a good question to ask your medical oncologist or your surgeon if all the genomic testing that is approved has been done on the tumor so that that information is available. There was data presented at American Society of Clinical Oncology's meeting in 2021 that only about 46% of all eligible patients got full molecular testing panel. What does that mean? That means that over 50% of patients were getting care with incomplete information. So we know they have cancer, we know they have lung cancer, but we don't know all the information that is necessary to treat them, because that would alter their path of care, that would alter the treatments, or that would alter the medications I would pick. So this is critical that we have effective care, and that is something that needs to be discussed with the care team at the visits. Access to clinical trials. Now, this is again a question that a lot of patients and family members don't ask at their first few visits with their oncologists or with their surgeons. Often the thought process is a clinical trial is something that I do only after I have exhausted all my available treatment options. That's not the case anymore. Clinical trials are something that could be offered upfront. You could have access to a very high quality clinical trial right at diagnosis, and is something that should be available to you for discussion, even if it's by a second opinion. It's not something that we do anymore as the last option. Sometimes a clinical trial might be the best option for somebody with a new diagnosis of lung cancer. So at least bring that up in the discussion, no matter where you get care, if it is in the community or in an academic medical center.